Our study was the FLIER trial. It was a big multi-center, multinational, randomized phase 3 trial. Israel, Italy, Norway, Denmark and Germany took part in it, 138 centers, and they randomized 592 patients. 588 were analyzed in the final analysis, and we included patients for frontline therapy of aggressive B-cell lymphoma if they were up to 60 years of age, if they had limited stage disease, an age-adjusted IPI of 0 and no bulky disease, meaning that their tumor maximum diameter was less than 7.5 centimeters. Those patients were randomized to receive either 6 cycles of R-CHOP 21 or 4 cycles of R-CHOP plus 2 cycles of rituximab. The 3-year progression-free survival after 6 cycles of R-CHOP was 94%, and the 3-year progression-free survival after 4 cycles was 95%, and therefore we didn't have any difference between the two arms, and so we could prove non-inferiority of our experimental arm. And also event-free survival was equal, and overall survival as well, so that for us we think that 4 cycles of R-CHOP are sufficient to eradicate the malignant clone, and that might be, after a scientific discussion, the new standard in this patient population. With respect to toxicity, we could reduce hematological toxicity by about 1/3 and also non-hematological toxicity by 1/3. And this is, I think, very important for patients if they have only 4 cycles of CHOP. In our trial, we will further look at the patients that relapsed, because we had the same relapse rates in both arms, but we still see relapses ongoing with further follow-up, and this is not very common in this field of aggressive B-cell lymphoma, and we have a look at that and whether they have a different biology. And maybe it would be interesting, or it would be definitely to be interesting, to have a look after 4 cycles, to do a PET, and to further improve patients being PET positive after 4 cycles of R-CHOP. That would be interesting.